Hi, I'm Dawn Evans from Ajuda Limited, and in this video I'm going to teach you how to deal with an unconscious, non-breathing child. If you come across a child looking lifeless and unconscious on the floor, the first thing you need to do is just check there's no danger to yourself or the child. Make sure there's nothing life-threatening around you. Once you've established that the area is clear and there's no danger to yourself or the child, you then need to check the child's response. You do this by gently tapping them on the shoulders and giving a word of command, "Are you all right?" "Hello, hello, are you all right?" Then I would shout for help. "Help, help!" Hopefully someone will hear your cries for help and will come and assist you, and obviously call that most important number, 112 or 999. You then need to proceed. You need to establish that the child has an open, clear airway, and we do this by performing what we call a head tilt chin lift, placing one hand on the forehead, two fingers under the chin, and just gently moving that chin back, removing the tongue off the back of the throat and maintaining an open, clear airway. We then move on to B, which is for breathing. We need to check that the child is breathing normally. You place your ear to the child's mouth, you listen, and you feel for breath on your cheek. You also look down to the chest and look for the chest to rise and fall, and try and establish if the child is breathing normally. Once you've established that the child is unconscious and not breathing, you need to make sure that you phone 112 or 999. Get help straight away. If there's a defibrillator in the building or in the home, you need to ensure that's put on immediately onto the child. If you're on your own, you need to commence with CPR for 1 minute before leaving the child to get help.
Tear open package and remove pad. Tear open package and remove pad. Tear open package and remove pad. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patients. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing buttons to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths. Give breath.
Once the defibrillator pads are on the child and once the defibrillator is brought in, as you can see my colleague Tom, He switched the machine on and followed the instructions of the defibrillator. If there is one available, this is what you need to do. You would continue listening to the defibrillator and continue with your CPR on the child until further medical assistance arrived. If you became too exhausted that you couldn't continue, or if the child showed active signs of life. If the child does show active signs of life, you then need to turn the child over to the recovery position with the defib pads still attached to the child's chest. If at all the defib pads are looking like they're going to touch because the chest of the child is too small for them to go in this position here, you then need to place one pad in the centre of the chest and the second pad needs to be placed in the centre of the child's back. If the child is so small that you think the defib pads are going to touch, then we place one in the centre of the chest and one on the child's back. So then it will send a shock through the centre of the heart via the front and the back of the child. If they're not likely to touch, then follow the instructions of the defibrillator. Place one on the right shoulder and the other one on the side of the left ribs.